Stem cell therapy for congestive heart failure. Breakthrough treatment explained. Hello, I'm Josh at DreamBody Clinic, and we have been treating a lot of patients over the past 8 years with congestive heart failure caused by either post heart attack or other issues with the heart that have led to this. And if you have this condition, you'll know already that there's not much they can do for it. In the United States, for example, they'll give you maybe some pills to deal with the pain and deal with slowing down the progress, but not much outside of that. And if you talk to any cardiologist there, they'll tell you, we can maybe slow it down, not much else we can do. We have helped a lot of patients by doing our stem cell IV treatment, which when it goes in the IV, goes straight to the heart and starts healing. And these patients have gone from ejection fractions all the way down below 30% back up to over 55%, which is considered normal. You have to be below 55% ejection fraction to be considered in heart failure. And we are getting patients back up above that. We've had some that even gone back above normal, closer to 65%. It's been incredible. And we don't just say this, we back it up. We have a ton of patient testimonials at the website at www.dreambody.clinic. You can click on the link and see those, but it works really well. And explaining it is this: so the stem cells in the IV go right to the heart. First place they go, they'll then pass through the rest of the system, but they naturally seek out inflammation. And when you've got damage, when you've got heart failure or other issues, it typically tells the body, hey, inflame this area, tell the body it needs help, start healing. The stem cells react to that, and when they get there, they start guiding the repair process. So we use mesenchymal stem cells. We derive them from what's called Wharton jelly and placenta. This is tissue that would have been thrown away otherwise during the birthing process, so it's totally ethical, totally safe. You get really young, healthy cells. And because here in Mexico, we can isolate and replicate them, we can get very large amounts. It's like a 300 million IV for most guys who have this issue, or women, goes straight to the heart and starts healing the heart. It's gonna look for inflammation, it's gonna look for scar tissue, it's gonna look for damage, and it's gonna help guide the removal of any scar tissue. We had one patient where 1/3 of her heart was necrotic after a heart attack. Her ejection fraction was under 30%. She did just 100 million IV, and within a year, we had healed all but a tiny piece of the heart from that necrotic tissue. So it works incredibly well, getting rid of dead tissue, necrotic tissue, getting rid of scar tissue, and then that allows the cells to guide the repair of the underlying heart tissue. And when that happens, it starts regenerating, brings back proper blood flow, gets it pumping properly, and works well. So it's very simple yet complicated. I mean, we still don't even understand why the stem cells react this way, why they're so good at going to inflammation. But we do know when they get there, they start sending out these signals. They work via what's called the Paracrine effect. It's the signals they send out called extracellular vesicles. They're getting the name exosomes now, and there's over 1,000 different types. So they send these out, and each one's a single payload delivery system to communicate with other cells, growth factors, peptides, all these things in the body to help organize the healing process. Now, exosomes by themselves don't really do much. Sometimes they'll help a bit, but it's like trying to hunt a deer with a shotgun. You might, spray and pray, you might hit it, but very unlikely. Where the stem cells are going to deliver a targeted shot to get things fixed. They're going to inflame the right areas. They're going to tell the body to work on areas that are inflamed. They're going to say, get rid of the scar tissue. They're going to help repair nerves. They're going to help rebuild tissue that needs to be rebuilt. So they're highly specific. They are the smart aspect of this healing process. They'll influence the immune system, get it to work properly. If it's not working properly, that's why they work so well with autoimmune diseases. They'll reprogram the immune cells to work the way they're supposed to. But everybody, as we age, their immune system works less well. So by having more managers in there, these stem cells, you're going to get the job done quicker and more efficient. And it's just been incredible to see, when you see these people come back with their new echocardiogram results and they don't need a heart transplant, it's unreal. It makes me feel so good. We're so happy to help these people. So if you'd like to learn more, go to the website at www.dreambody.clinic. scroll down on the homepage, you can click on the congestive heart failure treatment. It's got all the information there, prices, testimonials, links to studies. It's all there. If you'd like to call us, free consultation. You can send in your echocardiogram results, any blood work. We're happy to review it for free. Make sure you're a good candidate and go from there. So you can call us toll free at 888-704-3977. I'm Josh. Happy to help.